When we ask ourselves the question, what is it with visceral obesity driving risk of diabetes and cardiovascular disease? Well, I would say it's time now to pay tribute to pioneers, such as Gerald Reaven, who introduced the notion of syndrome X, insulin resistance syndrome. And in his landmark Banting lecture in 1988, he was really the first to suggest that there was a fairly large proportion of individuals out there who had increased risk of type 2 diabetes and cardiovascular disease because their tissues were resistant to the action of insulin. Our work using imaging has shown that this insulin-resistant state is found among individuals storing fat at the wrong place. So if you're viscerally obese, you become insulin resistant, and this is also accompanied by an inflammatory state. So for instance, the very popular marker known as C-reactive protein is markedly elevated in abdominally obese individuals. And in addition to this, you have a very specific dyslipidemic state, which is called an atherogenic dyslipidemia, which includes high triglyceride level, low HDL cholesterol, small dense LDL particles, an increased concentration of ApoB lipoproteins, and small HDL particle. So therefore, when you put together this cocktail, insulin resistance, inflammation, atherogenic dyslipidemia, I call this a minestrone soup, actually, substantially increasing your risk, not only of cardiovascular outcomes, but also of type 2 diabetes.